welcome to the Stroke Recovery Group. I'm so glad you're here. Hey everyone, welcome back to the Stroke Recovery Group, brought to you by Eye Care for Your Brain and the Foundation of First Health. Welcome back. I'm very excited that we're here again together. We're going to start off by going through a recap of rule number 1, make your map. If you were with us during the last session, you should have done a lot of thinking and maybe even some research about your personal stroke and the impact it's had on all of your person. The first thing I asked you to do is do some research about where in your brain your stroke happened. I also want you to understand why it is you had your stroke. If the doctors understand, you should as well. The third thing I asked you to do is to identify any updated evaluations that might serve you in incorporating all of your symptoms into the Stroke Recovery Group. I also asked you to identify what is your why, what is your motivation for being with us in the Stroke Recovery Group. When we talk about making your map, what we're really talking about is figuring out exactly where you're at now with all your symptoms, and then also really figuring out where it is you want to go. And the way we think about it is that that is your precious recovery between those two hands. You have to hold on to this recovery with all your might and give it all of your heart. I also asked you to think about how you could incorporate the 3 different gold standard interventions that will serve you in this recovery journey. The first one is the repair of damaged cells in your brain, making new connections between brain cells that haven't maybe been connected before to get you back a certain function or a certain skill. Next one is learning to compensate, workarounds. How is it you can use a different part of your brain to get the same result? And the third one is acceptance of changes of the things that may not return to the way that you were before your stroke. As you now know, all of these changes require neuroplasticity. And we talked about exactly what a neuron does. Brain cells connect with each other to help gather information, summarize that information, and communicate it downstream. So when we talk about neuroplasticity, what we really want to do is encourage the growth, the regrowth of those dendrites you see on the front end of the neuron and the synapses that we see on the back end of the neuron. Neuroplasticity happens by rebuilding and rewiring brain networks. If you were with us last time, you know that the brain is organized into countless interconnected, personalized networks of brain cells. And that is really the key to our rule today. Brain networks are established very slowly in all of us over time through our life experiences, namely education, hobbies, interests, and relationships. And they become more and more complex over time. In a stroke, it's either the network itself that can have damage, or it might also be access to that network that has had damage. This happens because a stroke is a focal injury, and I really want you to remember that. You have not had a whole brain injury. A stroke is really damage to one part of the brain. So you've got the whole rest of your brain to try to get in line, to jump in and help you with the jobs that that part of the brain did. You now know that neuroplasticity happens best in what we call an enriched environment, which can be defined very simply as surrounding you with a complex, stimulating environment with periods of focused, repetitive activity, but also periods of high-quality rest, including REM and non-REM sleep. So now that we understand that very important first rule, we're going to move into rule number 2, and we call this one, build on what's familiar. And I want you to really wrap your head around this. A stroke didn't just happen to any brain. This stroke happened to your brain. Building your rehab on what's familiar to you is going to give you the very best recovery. Cookie cutter rehab, where one size fits all approach, is really not in line with what cutting edge neuroscience tells us results in the best recovery. We must personalize your recovery. Experiences make their mark on the brain. All humans are different. Just like our fingerprints are unique to us, so is our brain. Researchers say that the structure of the brain is shaped by a combination of our unique genetics, but also our individual life differences. What's interesting is research on professional athletes, taxi drivers, chess players. When you look at their brain in an MRI machine, they actually have extra gray matter in the part of their brain that they need to do their personal job. And so if we try to come at stroke recovery from this one-size-fits-all perspective, we're really not going to get the best out of it because we're not tailoring it or customizing it directly to you. So how is it that we can bring more of you into this recovery? Well, we have to really try to get personal. A stroke damaged a specific part of your brain network, and the job of recovery is rebuilding these personal networks as very best we can. One way that you can think of your stroke is kind of like a house that weathered a storm and had a tree fall on it. So if you look at my picture here, you can kind of get that image. What we really want to do is simply rebuild the part of the house that was damaged, okay? And when we talk about the damaged parts of the brain from stroke, we're going to go back to this all-encompassing graphic that helps us really respect all of the different impacts that you've had from the stroke. So remember, it's not just physical symptoms, it's not just things that your doctor can see, it's all of the different ways that your stroke has impacted you. And I want you to start to think of yourself kind of like a bricklayer. Stroke recovery is not a sprint, it is absolutely a marathon, and many times recovery happens brick by brick, step by step. The strongest adhesive that you have for putting this building back together, putting this brain back together, are really exploiting your lifelong interests, your hobbies, your passions, all of the things that make you you. So one way to really think about this is that you are the glue. Your life experiences are going to be the very best tool that we have for rebuilding these brain networks. So the invitation of rule number 2 is to bring more of you into this rehab. Research shows us that when therapies are personalized, they are more empowering, people are more motivated, they do their rehab exercises more, and they get better results. When rehab is personalized, you will be much more a part of your recovery, and that is essential to getting you the best outcome. There are 3 ways that you can personalize your rehabilitation by building on what's familiar. The first one is to personalize your therapies, and we're going to talk about that today. Number 2 is personalizing how you get motivated to do your therapies. Motivation is key here. If you don't feel like you are up for doing the rehab exercises, you're not going to get the benefit of them. Of course, you have to do them. And also personalizing the way that you reward yourself after a tough therapy session is an awesome way to really make this a customized experience for you and your brain. So the first thing is, let's talk about how is it that we can personalize your therapy. The thing I really would love you to think about is the unbelievable brain power that goes along with the hobbies that you've had your whole life. We typically have hobbies because we're very passionate about them. We have wonderful personal associations with them. And a lot of times our hobbies really do become part of our identity over our lives. So let's just take a couple minutes here and really reflect as we go through our lives and think about what are the things that we were most passionate about at different parts of our life. So when you get your interactive worksheet for this rule number 2, you're going to find this and you can write this in your own time. But for now, let's just think of a typical gentleman who's maybe had a stroke at the age of 79. What I'd love for him or you to do is go back through these different lifespans, these different periods in your development, and really make note of the type of things that you greatly enjoyed doing at that time. So if we just take age 0 to 15, this gentleman might have been someone who grew up in a baseball family who absolutely loved the Chicago White Sox. And he has all sorts of information in his brain about famous games and players and what positions are played, and all sorts of great memories with his family, wonderful, wonderful, warm times in his life. Perhaps then when he's 16 to 30, he starts to get interested in cars. So now he has networks in his brain that are related to all of the classic cars and how to repair different parts of the cars when they break down, and maybe thinking about his very first car. And there can be a lot of emotional salience for us when we think about things like that, like our very first car. Then perhaps as he goes into age 31 to 45, now he is developing a career. And he was a salesman, and perhaps he sold lumber. So he's got all sorts of information in his brain about different types of trees, how you fell trees, the things that you can make from trees, the people he worked with, all of those relationships. As he gets older, 46 to 60, perhaps now he is raising children, perhaps he's even having some grandchildren, and he's getting more interested in things like golf. And he is learning how to play golf. He is understanding all of the hand-eye coordination that comes along with golf. He's got new golf buddies. So there's a whole network in that brain that just relates specifically to golf. Then as we get more into 60, 75, he's starting to think about retirement, and maybe he's thinking that he would like to travel. And there's all sorts of memories in the brain about trips that he's taken and the experience of going to the airport and packing and making the plan for trips, and just wonderful visual images in his mind of all the wonderful trips that he's taken. Then once he gets to the age of about 76, he's still very involved with all of these things. He loves to catch a White Sox game, can talk to people all day long about lumber, loves to talk about his trip to Egypt. This is the unique brain that this gentleman had going into his stroke. And what we really want to do is exploit all of that experience and leverage it for the very best stroke recovery possible. So I want you to do that exercise, and your job is to return to these passions and interests to fuel your rehab. So again, let's just go back to an example of a gentleman who really liked golf, okay? After his stroke, he had, let's say, a right middle cerebral artery stroke, and that has left him with some left arm weakness, and this gentleman happens to be left-handed. After many years of playing golf, he's got this brain network that is involved with balance, hand-eye coordination, visuospatial skills, the memories, the competitive spirit that he uses when he's playing golf, feelings of satisfaction, victory, and it's really part of his identity. This man thinks of himself as a golfer. The simple act of using a golf ball instead of a typical therapy ball in his hand for redeveloping fine motor skills will activate this golf network and lend much needed fuel for his recovery. Just something as simple as that, replacing a typical therapy ball with a golf ball. Now all of a sudden we are accessing all of this network, all of this fuel that he has that can now be pushed into the recovery. Let's also maybe take someone who has a lifelong love of flowers. Look at these beautiful dahlias we have here on this slide. And unfortunately, perhaps this is someone who had a left middle cerebral artery stroke, and she is struggling with some aphasia. She may know the words that she wants to say, but she cannot find the words. She is having a hard time with her expressive speech. So after many years, this person absolutely loves flowers, and she has brain networks that know the names of the flowers, the parts of the flowers, memories of how to grow flowers, how to arrange them, how they smell, feelings of wonder and peace when she sees a flower, and again, identity. So much of who we believe we are in life is based on the things that we do and that we love. So instead of just using generic flashcards for this woman to work on her word finding, we can incorporate flowers and use flower flashcards to help access that network, to give her something personal that she is motivated to put a lot of work in to return that function, that skill. So what I'm really saying here is I really want you to use your unique brain networks in order to boost your recovery. What is so important to me, and I hope becomes important to you after this rule today, is that you don't simply give up on the things that you used to value and enjoy in life just because you cannot do them the same way that you did them before. So I really want you to see that you have a choice here. There is a fork in the road. If you go one way, you go on. Yes, it may need to be changed, it may need to be modified, but if you go the other way of giving up, I can't do it like I did it before, so I'm not going to do it all, what you're really doing is you're risking losing all of this fuel for your rehab. Look at this beautiful distributed network in this brain, okay? If you don't return to golf, perhaps in a modified way, if you give up your love of flowers, what's going to happen is this brain network is not going to be stimulated, and it's the old use it or lose it approach. So I want you to meet your recovery where it is. So again, let's just take 3 hobbies here of 18-hole golf, playing piano, and gardening. You may need it to be slightly modified. Perhaps you now do 9 holes. Maybe you used to walk before, but now you need a cart. If your impairments are significant, and perhaps that's not a possibility for right now, you can try to putt inside, hold a golf ball like I was saying before, talk about golf with other people, put golf on the television for the person to watch. Being actively involved in a previous hobby is of course ideal, but there's all sorts of ways that we can also bring that hobby to the person, even to the most passive of simply having the TV or the computer on with these type of activities playing in the background. Playing piano is another example. So even just sitting at the piano, and maybe it's difficult to play a full song, maybe it's difficult to remember the specific keys that you need for a song that you knew previous, but just sitting there and having the experience of interacting with the keys, hearing the tones, listening to the sounds, all of that is going to activate those brain networks. Again, if that's not possible for the person, just having them listen to songs that are familiar to them. We're going to talk a lot about music in a few minutes, one of the most powerful weapons that you have in your recovery. And the last one is gardening. Gardening is something that is so positive and rewarding to so many of us. If you're not able to get up and down, if you're not able to have both hands to potentially make holes and get those seeds in the ground, you can ask someone to have a raised bed for you. We can do container gardening, or you might just also ask someone who cares about you to plant a very low maintenance little garden outside your window so you might be able to look at it. The concern that we have is you just don't leave all of these hobbies behind, because again, if you don't use it, you're going to lose it. And this is a really important piece of information. Brain cells that do not get stimulated don't think that they have a job to do, and the brain is very efficient. If it doesn't feel like it has a job, what those brain cells do is they start to shrink, and they can even self-destruct. And once they go away completely, it is hard to get them back. And what we get most concerned about is that it can start a cascade of what we call neurodegeneration, which means other brain cells close by kind of see what's happening and they take suit. They're kind of copycats. So the auditory cortex is a perfect example of this. There's been a lot of research recently on the dangers of untreated hearing loss. And we used to think if people didn't have a good hearing evaluation or they didn't wear hearing aids, that the dangers were really social. And this is true for sure. It can cause people to withdraw. They don't want to go to dinner parties. It's very frustrating not to be able to hear something. But what we now know is that it's actually a significant risk factor for developing dementia. Because if those cells in the auditory cortex, which pride themselves on having one job, which is processing and interpreting sound waves, they get up and basically leave the party. And so folks who don't wear their hearing aids consistently, it is a very strong independent risk factor for developing dementia. This is pretty important of an insight for us to understand. You really have to prioritize getting the person back into the things that they previously enjoyed, or else what we get worried about is that we're going to lose brain matter instead of what we're trying to do, which is to rebuild brain matter. You can also personalize how you get motivated to do your therapies. Motivation is a basic principle in rehabilitation and is one of the predictors that we use to determine where someone is going to wind up in the recovery, how much return of function that they're going to get back. While most of you know the value of rehab exercises, a lack of motivation, difficulty putting in that effort that you're going to need, especially once you're home away from a therapist who can kind of crack the whip on you, this can become a serious barrier to an optimal recovery. So personalizing your rehab exercises to include things that are of interest to you, that you're passionate about, can really help people overcome low motivation. Of course, there's the very real barrier of neurofatigue, post-stroke exhaustion that many of you struggle with, and we're definitely going to address that in a future session. So let's just think about the concept of motivation, and you really need to identify for yourself what is going to motivate you. There's really two different ways that we're motivated as people. The first one is what we call intrinsic motivation. What I mean by this is that the motivation comes from within you. When you're intrinsically motivated, you do therapies because you enjoy it and because you have a personal sense of satisfaction with it. Some of you may have always been very competitive people with yourself, and you're going to be intrinsically motivated. You want to do the work because you really want to see the outcome for yourself. So I'd like you to name one intrinsic motivator that you can bring into your rehab therapies that is going to help you specifically get going. The next one is called extrinsic motivation. And when we are extrinsically motivated, we have external rewards that get us going. For a lot of us, praise is a wonderful external reward. We want other people to be impressed with us. We want to make them happy seeing how hard we're working. Other people can use things like a cookie or a cake. There's all sorts of ways that you can find little rewards along the way to keep yourself going. So again, I want you to try to name one extrinsic motivator that's going to keep you going. And this is a personal question, right? Because what is going to motivate me is not necessarily what's going to motivate you. I would love for you to take my next question very seriously. Have you brought music into your recovery? Music is the perfect way to personalize your rehab because it's so personal to us and it's extremely emotional, making it the very perfect way to personalize rehab. Shakespeare reminds us that when words fail, music speaks. Music is universal. The idea is that the way we are first brought into this world is through hearing our mother's heartbeat and our own heartbeat in harmony together. We are very humanly based in melody and rhythm. Music helps to rewire the brain after a stroke, so why not incorporate it into your rehab? The benefits for folks who are in the hospital with stroke, when they are allowed to listen to music of their choice, we know that these people get arm function back quicker. Non-fluent aphasia gets better when people listen to music. People's gait, their walking improves, their overall cognition improves, mood gets better, and there is more social interactions when there is music around, probably speaking to how universal music is. Stroke survivors who listen to self-selected music every day for 2 months in one study had less depression and less confusion. I think we would all like that. The patterns of music are very stimulating to the brain, and there's strong evidence for a relationship between melody and rhythm exposure and the reorganization of brain cells. So I want to tell you about one specific study that was done in 2008 that looked at the relationship between music and cognition. 60 stroke survivors were enrolled in a study soon after they were hospitalized for a pretty significant stroke. They all received the same standard stroke care, but in addition, a third of them were randomly assigned to listen to recorded music for at least 1 hour a day for 3 months. Another third of the group were able to listen to an audiobook, and the final group had no specific auditory stimulation given to them. In the music listeners, verbal memory improved by 60%, and focused attention improved by 17%. And what is so awesome about this finding is that this is a passive exercise. Yes, as we listen to music, we can't help but get involved with remembering the melodies and the lyrics. But even if someone is non-responsive after a stroke, music is a really powerful way to start that process of getting the brain working towards reorganization. Music also directly affects our nervous system. The brain is part of the nervous system, so anything that we can do to soothe, to comfort, and to stimulate the nervous system is a good idea, specifically the parasympathetic nervous system. So what music does for us is it really reduces our hypervigilance, it reduces our feeling of being uncomfortable in an environment. It really reduces that fight, flight, or freeze response. We know that when we are listening to music that makes us feel good, our stress hormones fall down, our feel-good chemicals, our endorphins go up. It helps to regulate our breathing, our blood pressure, our heart rate. And what I think I like most about it for folks after stroke is that it provides a sense of predictability in that we can anticipate the beat the rhythm, the lyrics. So much of that first phase after you have a stroke is unpredictable. Things are out of control. It's scary. It's a time of low security. So bringing familiar music into recovery, especially early on, can really be a way of taking a break from the intensity of what's going on around you and also getting back into that familiar memory of what that song means to you. We also know that music has a direct effect on blood vessels. And if you were here with me for rule number 1, you learned that it's all about open, smooth, happy, blood-flowing blood vessels, right? We need that blood and oxygen and glucose to get into our brain cells on a very steady, regular basis. So listening to relaxing music in one study helped blood flow open up by about 26%. That is pretty amazing. When blood vessels expand, not only do we get more of that blood flow that we want so badly, but we also release nitric oxide, and that is a very helpful substance in helping to reduce blood clots from forming. Music also really helps us emotionally. It helps us to identify, to process, and to release our emotions. How many times have you listened to a song and you might not even be knowing you're feeling a certain way, and boy, those lyrics or that piano or that guitar just hit you and you find yourself having a big emotional response. When emotions are unexpressed, we have more muscle tension, we have more fatigue because we're carrying around that tension, we can have more pain because our muscles are so tight, and we can have more irritability. All of those things lead to more medication. And what we really want to try to do after a stroke, after any kind of brain injury, is really have you take the medications that you need to take. We want to reduce what we call polypharmacy as much as is possible. When we listen to music that makes us feel good, like I said before, we have less stress hormones, things like cortisol. When you have less cortisol, you have less inflammation, and your immune system can really focus on your brain. Your immune system is working overtime for many, many months, if not years, after you have a stroke, because it wants to break down all of the damaged brain cells and really clear out all of that debris. Lyrics of songs can be incredibly stimulating for making us realize that we have options and choices. There's so many times where I've listened to a song and it feels like now I know the next step because of what they sung about in the song. So it really can open up our idea about possible solutions to our stressors. Music can really aid in acceptance and closure. So much of stroke recovery is emotional, yet we really don't talk about it enough. And oftentimes, even when we go to the doctor after a stroke, again, we can be so focused on the physical that I really want you to take bringing music into your recovery seriously, because this is something that you can do in a self-guided way to help address that whole person stroke recovery that we talked about last time. Instrumental music in particular has been shown to reduce depression levels in stroke recovery. So a great question is, well, what kind of music and how often should I be listening to it? And again, the answer is it's all about you. Personalization is the key. The most evidence-based information we have is if we focus on the music the person knew from the time they were about 17 to 25. This seems to be the most emotionally salient musical memories that we have. Oftentimes when people have left hemisphere strokes and they're struggling with aphasia, language-based symptoms, either understanding or saying their words, many people have very strong ability to sing. And this is because singing and melody and memory for song lyrics happens in the other side of our brain, the right hemisphere. So if you or someone you know is struggling with aphasia after a stroke, please, by all means, bring in music so the person can have that empowering, satisfying sense of being able to sing, even if speaking is difficult. Many studies show superior effects with the more music, the better, but there's also studies that have shown that even one song can improve someone's recovery. I think that's pretty amazing. So I invite you to have a recovery song. This is your fight song. This is your song that really gets you motivated, gets your blood pumping to focus on this recovery. And here are some suggestions that I came up with on my own, but it's really, again, it's all about your personal choice. A song that would maybe make you really feel like you're pumped up and ready to go for your recovery. So we've got Eye of the Tiger by Survivor. We've got I'm a Believer by the Monkees. all the way down to Marvin Gaye, Ain't No Mountain High Enough, We Are the Champions by Queen, the awesome Stevie Wonder, Higher Ground, Never Gonna Give You Up by Rick Astley, any song that has made you feel happy in the past, any song that you can use either before therapy or perhaps as a reward after therapy is really recommended. So one other way you can make this therapy your own is to personalize what you do after your therapy. So this is positive reinforcement, and this is basic psychology. It's a very powerful thing. You must reward yourself in this recovery journey. It's not going to go as well as it could if you just think you can push, work. Remember, what an enriched environment is yes, intense, repetitive, consistent effort, but we always have to have that other side of high quality rest. And part of rest is reward. It's rewarding yourself for your hard work. When we get a reward, we get very big dumps of these great feel-good chemicals in our brain, specifically dopamine, that encourage neuroplasticity. So it's kind of like a bonus on top of doing the hard work of the therapy. When you give yourself a reward after, you're kind of making it even better for yourself. So listening to a great song after you do a difficult rehab session is an awesome way to personalize the reward. I really want you to fine-tune your mind to even notice the smallest victories as you go through this recovery and reward yourself with something that you love. Again, I can't answer this question for you. You and your inner circle, your team, have to really think about what is something that would reward this person. And as we know, stroke recovery happens on a spectrum. So we have folks that are capable of completely guiding their own recovery, all the way down to some of our loved ones are struggling with things like locked-in syndrome, where they have had a brainstem stroke and they are unable to do very much for themselves at this point. If that's the case, what we do is we think back to that person before the stroke, and we think about what would that person be motivated by. We think about what that person would really appreciate as a reward. It can be something from putting something on the television in the hospital room. It can be to cooking them their favorite food that they had before, or if this was someone who really thrived on praise, just make sure that you're laying it on nice and thick. I want you to advocate for personalized rehabilitation. We really need to move the ball on making rehab more personalized and more progressive. So I want you to ask your medical providers, how is it that we can partner together to bring more of me into my recovery? When we focus on person-centered rehab, to me, this is an actionable way to say that no two people are the same. Each person deserves respect. And every single stroke recovery is going to be unique. Personalizing your rehab is a way of also putting you at the center of the stroke recovery journey and not your stroke. So remember, we end every session with a self-empowerment statement. And the one for rule number 2 is I will bring more of me into my recovery starting today. So I want you to use our interactive worksheets to try to figure out how is it that I can use all of my unique life experiences and customize them into my rehab therapies today. Remember, when you do that, you're going to participate more in your rehab, you're going to get more out of it, and you are going to be much more engaged in the stroke recovery journey. I hope you guys will join us next time for rule number 3. That's when we're going to talk about the importance of repetition and consistency. I think you will be amazed at how much more work it takes to recover function than you might think now. So thank you guys so much, and I look forward to seeing you next time. Bye-bye.